Good evening to everybody. We are having this webinar basically in the interests of the non-medical fraternity. There have been so many questions in the past. There are already so many questions in our minds, and there are going to be further more questions as this disease evolves. We have within our midst today Dr. Sanjeev Mehta, who is one of the most renowned pulmonologists in the country. Dr. Mehta is attached to Lilavati Hospital and to Bharatiya Argunati Hospital in Juhu. He's been in this practice for the past almost 30 years, being a renowned name not only nationally but also internationally. He is among the few Indian doctors who has been the past chair of the Council of Global Governors for the American College of Chest Physicians, which is an extremely prestigious position. Dr. Mehta has been treating COVID patients over the past 1.5 years. Being at Lilavati and seeing patients in the ICU, he has a very comprehensive and in-depth knowledge of the subject. And I'm sure hearing him for the next 25 to 30 minutes, seeing the slides that he has prepared for us, will give us very good insight on the disease, what we have seen, and what we can expect in the future. I would also request, sir, Akash, can you please mute everybody else currently? There seems to be some disturbance behind.
Yeah, so I have muted all. You have to unmute, sir.
Yeah, so sir would be speaking to us for about 20-25 minutes, and thereafter we would have an interactive session wherein, in the interest of time, I would request everybody in the chat box to post their questions and address them to me so that I could moderate the questions, see to it that questions are not repeated, and I'm sure sir will be kind enough to answer whatever questions people in the webinar have for us. So with that, sir, I would request you to start with your presentation and take it on from here. Dr. Sanjeev Mehta for everybody.
Thank you very much. Right at the onset, I'd like to thank my very dear friend, Dr. Vikram Pal. Vikram and I go back many, many years. And that's a reason why he gives me an introduction that is kinder than I actually deserve. If it is not for my age, I would be blushing at that kind of an introduction. But Vikram, thank you very much, not only for that lovely introduction, but for arranging this. I would also take this opportunity to thank my very dear friend, Akash Falke. Akash is, again, a very dear friend for many years. He's in Sun Pharmaceuticals, and he has sponsored, in a way, the organization of this program. So thank you, Akash. And I know Mr. Vasan is there. I want to thank both of them for their support, not only to me, but yes, Mr. Vasan, hi. And also thank you for your support to me, to COVID, and to this program. So the reason why this program came about is because, in dealing with COVID, and now, of course, we are seeing the tail end of the second, shall I say, wave, is because there are more confusions, more doubts, and a lot of people are completely scared, completely worried, and completely confused. So I think it's time you talk to a doctor rather than attend the University of WhatsApp and the University of guesswork. So let us see. I'll try to bring to you whatever information I have, and if we can, then I'll try to clarify the doubts. So with your permission, Vikram, thank you, Mr. Vasan. And with your permission, I'd like to share my screen. So I hope I can share this. Can you all see my screen?
Yes, sir. Yes, sir. Visible.
Perfect. Great, great.
Yes, sir.
So let me go to slide. So basically, let me try to talk to you on COVID-19 as I see it in June 2021. Last month was a different talk. Next month, I sure will be different. But this is what we have today. So this is a crazy pandemic. More people, I think, have died in this pandemic than they died in any of the world wars. This is the pandemic that has caused more global destruction than I think any other event in the world. And you can see that the worldwide cases, I mean, numbers have just become benumbing. So I won't go over the numbers. This is the beginning of the second wave. But what is good is that even as we speak, most of the cities are going down. You can see Mumbai, these are Maharashtra cities, everything is coming down. And the there are a few small areas where it is yet there. But overall, I think we are seeing the end of the second wave even as we speak. So I don't know if any of you recognize this picture, but I brought this because I think you must come face to face with your enemy. This is the coronavirus. This is COVID-19. What you see here, and if you can be a little more imaginative, you see these sticks coming out. This is like a crown with its spikes. This is what it looks like, a crown with the spikes. And these spikes are what I think everybody today knows in every household. These are called the spike proteins. Now, I'm sure all of you have heard about the spike proteins, and that is because of this figure, which says, which you can see, this is the coronavirus. It is covered by these spike proteins. These spike proteins attach to the human angiotensin converting enzyme receptor. I use this word because I know many of you would be using ACE inhibitors as antihypertensive drugs. We have on every one of our cells. This horrible virus attaches to the ACE receptor, and when it does that, it becomes internalized into the human cell. This becomes important for us because all treatments essentially are directed at this part of the whole game is here in terms of the virus. So the antibody cocktail basically is antibodies that block the spike protein binding to the ACE receptor. The vaccine that we are giving is also directed to block the binding of the ACE receptor, thereby making the virus completely impotent. The mutation, the delta mutation, and all the mutations are essentially mutations in the spike protein, because as we become smarter and want to target the spike protein, the virus becomes even smarter. It changes the spike protein. And now you'll understand why you would have heard the word which says this vaccine is ineffective, or this cocktail body is ineffective. Why it is become ineffective is not because it became bad, but it becomes ineffective because the spike protein changes its shape. And because it changes its shape, now any antibody that is directed against the spike protein becomes ineffective. And I think that is why I had to bring and discuss with you a little bit about the spike protein. This is where the spike protein is, this is where it binds. I hope I'm able to give some clarity, and I hope you will be able to use this information as you understand what's happening to COVID. All the various mutations are essentially over here. Now, this virus is extremely horrible. It attacks nearly every organ of the body. And let me go over these organs. The one number organ that gets hit, and that is why we lung doctors came right at the forefront of this, is the number one organ which gets involved in nearly everybody is the lung. So you can see that the virus gets into the lung. It causes a massive damage in the lung. I'll talk to you a little bit. But no organ is spared. The number two organ that gets damaged is the heart. And unfortunately, very reasonably young people get heart attacks and chest pain. Many people I've got who get rhythm problems, fast heart rates, heart blocks, sudden deaths because of the damage to the heart. But you cannot escape the lungs. The number three organ is the brain. And in my experience, anybody who gets brain COVID, also known as encephalitis, in my experience, 90% of them have died. We have people who get eye changes. Everybody knows about the nose, that there are changes in olfaction, you lose smell. Some of it may even be permanent, though most of the times it is not. 99%, 90% it is not, but in some cases it is very long. I'm going to talk about it. I've got patients who got hepatitis. I've got one patient who's 2.5 months now in the hospital with hepatitis from COVID. We had about 10 patients with pancreatitis. All of them died. COVID pancreatitis is terrible. And most patients will present with diarrhea. So there's no organ that is spared. You can see from top to bottom, doctor, I only have fever. What are the features of COVID? And I said it can everything and anything in the present environment is a symptom of COVID. The lung is where the virus enters by binding to the lung cells. It sets up a massive inflammation. Don't go into all this. It sets up a reaction in the lung and it causes an inflammation. When people ask me, is there infection of COVID? No, there's inflammation of COVID, which is very different from infection. So when you do a CT scan, you will get a picture that looks like this. And you may use the words GGO or ground glass opacity. Now, this is a little opacification of the lung, a little whiteness in the lung. This is very, very early signs of COVID, happens very early. It then becomes a little more intense. This is what tells the severity of the disease. Unfortunately, all of you come to us, oh, mera score 12 tha, ab 14 ho gaya, it has got worse. No, that's not true. It's only when a GGO becomes fibrotic, then there is worsening, not by the silly CT COVID score. Now you can see this patient has become worse. There is involvement of all the lungs. This guy has a score of nearly 24 and 25. But what is important is this fibrotic changes. Soft changes have become hard changes, and now you know that this patient is getting fibrosis of the lung, or what is called as permanent lung damage. I'm going to talk to you a little bit about this because I fear that will be probably the third wave. The third wave is long-term COVID or permanent lung damage of COVID. These are some of the horrible CT scans we see, total destruction of the lung. These patients are in trouble. So let me talk to you now about some of the aspects of the disease and its treatment. You will have gone to doctors and suddenly you will get a lot of medication. Many months ago, and imagine in all other diseases we talk about years, this disease we talk of months. Many months ago, we realized that the first part of the disease is the viral phase. In the viral phase of the disease, you get mild fever, cough, diarrhea, headache, low WBC count. At that time, you should not be using steroids. Second, now the lungs are getting damaged, which I just showed you. Patient becomes breathless, oxygen falls. This is the time when the patient's lungs are getting affected. There are certain drugs to be used. And finally, in a very small percentage, fortunately, patients go into total destruction of all the organs. This is called the cytokine storm. And treatments will be different. I don't expect you to go into that, but just for your explanation. In the early viral phase, you can manage this patient at home when they have cough and fever, and these are the medicines we'll give you. Remember, this is the early viral phase. Most of the patients would be well. All they need is symptomatic treatment like crocin or Dolo or Lanol. That's it. They don't need anything more. So don't rush and take all those high level medications that are available. But if this patient is showing more symptoms or has a high risk disease, for example, this 99-year-old patient who got admitted today, on the very first day, now I know it is viral. He doesn't need steroid. What he needs is an antiviral medication. So what are the antiviral medications? Favipiravir and remdesivir. Both of them work similarly. Unfortunately, people like me were, it does not give you high TRP ratings. All the people came and said, oh, remdesivir do, nahi to aapka patient mar jayega. People went and bought in black. Remember, favipiravir and remdesivir work at the same level, at the same enzyme. So all our OPD patients, I gave favipiravir because this tablet can be used at home. Hopefully, you will be able to get the same effect without having to give an injection. Save a lot of cost. What we have started using now is monoclonal antibodies. That's what I'm giving to this elderly gentleman. As I explained to you, this antibody should block the virus from growing, from multiplying, and thereby preventing the disease from happening. This is exactly how convalescent plasma used to work. What it does is that the plasma prevents, with this ready-made antibodies, it prevents the virus from multiplying. I've not used this new 2-deoxy-D-glucose, which is an Indian drug, uh, and nor have I used much of pegylated. I've used one or two pegylated interferons. I can't speak for them. I yet have to understand how this 2-deoxyglucose works, but they're very simple, cheap, harmless medications, and probably is something that can be used in the early phase. As the patient gets worse, now we have to start oxygen therapy. And again, I would like to tell you, it doesn't matter how you get your oxygen, whether it came through a cylinder, through an oxygen machine or oxygen concentrator, or in the hospital through piped oxygen. It does not matter. What matters is the number, whether you're giving 2 liters, 3 liters, 10 liters, or whatever. I think everybody should have a pulse oximeter. And everybody who has symptoms, or at least in one building, you should have a few pulse oximeters that can be used, and they can circulate it within that society or within the community. But within a family, everybody should have a pulse oximeter. In case there's a symptom, then everybody can be monitored through that. When patients become serious, we use more oxygen support, and from 20% oxygen to 30% to 40% to 50%. And we give different things. I won't go into those details, but in a very rare case, patient, if he's really damaged, goes on a ventilator. And that's a bad sign, because if you need to be ventilated, it means the lung are damaged. Only about 20 to 30% of patients will survive, and that's a bad sign. When this patient gets really into the cytokine storm, now we kick in with steroids. We use drugs which you have all heard about. Many people bought in black, tocilizumab, itolizumab, and that's the other thing. Tocilizumab, itolizumab, and baricitinib all work the same way. There was no need for people to run around and buy tocilizumab in black, but people did. It's absolutely unnecessary. Itolizumab and baricitinib work the same way, and that is what we are using now. I'm using a lot of these latter two drugs. In fact, baricitinib is even easier to use. It's a tablet, and we can use it in the milder patients. What I've started to use is other anti-inflammatory drugs like colchicine. I always put my patients on aspirin, and most of my patients would be on blood thinners, because the second common cause of death is either brain attacks, paralysis, strokes, or heart attacks and clots. And therefore, anti-clotting should be, in my opinion, something that should be used aggressively right from the word get-go, and continued for a length of time depending on the patient's condition. If the patient came out of all this, then some of the patients are going to require long-term steroids. I have a very small percentage of patients, fortunately, who have needed about a month of steroids. Not small, that's about 10%. But going beyond the first month, there is a group of people who are yet inflamed. I think the second wave had more prolonged inflammatory phase. And so some long-term steroid users are there. It is saving their lungs from getting damaged, saving their body. I'm also using in these people colchicine and antiplatelets. Now, what is the long-term complications? And we use anti-inflammatory, antifungals. You heard of black fungus. But above all, what you need at home for many patients now is oxygen support, rehabilitation. And this I'm going to talk to you now today on managing the long-term complications of COVID. These are called the long haulers. So the word for is there are many words is a post-COVID syndrome, and many people call it long COVID. Many people call it, the official word now is post-acute sequelae of tongue twister. Call it long haulers, post-COVID. These are people who have symptoms for more than 3 months. So I have to reassure my patients. Patients ask me, Doctor, I am yet having symptoms after 2 months. Am I going to be all right? And I tell them it is not unusual to have symptoms for 3 months. I'm going to show you some of the information on that. So I want to reassure you that it's not uncommon and that we know how to deal with it. Do not panic. Do not be scared. So people who get more than 3 month symptoms are called long COVID or long haulers. Which organ does it affect? As you can see from this little busy cartoon, it can affect every organ of the body. And really, no organ is spared from long. And I'm going to talk to you a little bit about that. But the most common organs are the heart, the lungs, of course, the lungs, the brain. People can get clots for a long, long time, lose smell, and chronic fatigue is a huge problem. I have people who tell me, oh, doctor, I cannot concentrate. Many people tell me I'm weak. अभी भी वो ताकत नहीं आया है जो पहले था. That's a chronic fatigue syndrome. So this was an interesting study that came out in April this year, that was published in JAMA, which looked at 300 healthcare workers, doctors and nurses, 60 days, that means 2 months after their COVID. Those who had COVID positive, that means they were more severe, they had symptoms after 2 months. What about those people at 8 months? Those who had severe COVID, even at 8 months, they had symptoms versus those who are mild, only 3%. And 8 to 15% of them said that it interfered with their life. They could not complete their work. Many people will tell you that they are unhappy, disturbed, scared. I'll tell you all those. But it can go on for up to 8 months. Here's another group of people, now 1,600 people, just got published in JAMA, Vinod Chopra and group, Vinod Chopra. So they looked at patients who had been hospitalized. So these were the more severe patients. Now, it doesn't mean only severe are hospitalized. Now, many people are being managed at home. 33%, one out of every three hospitalized patients has symptoms after 2 months. The most common of these symptoms are breathlessness. Why? Lungs are damaged. Chest tightness because lungs and heart are damaged. Cough, again because lungs are damaged. And 13% at the end of 2 months could not smell or taste yet. So this is the complication. So what are the most common symptoms? And this shows you that up to 70 or 80% of patients have fatigue and breathlessness. Now, these are the people who are hospitalized in ICU, and these are the patients who are in ward. So you see, the more severe the initial infection, more severe are the long-term complications. And which is why I use antiviral drugs very early, uh, so that hopefully the patient doesn't get a severe attack and therefore has a better long-term outcome. But remember, they also have post-traumatic stress. Oh, an ICU is a horrible place to go. So at least 50% of them have stress, emotional disturbances, then just one second. Cough, again, more severe the disease, more the long-term complications. And then even urinary problems and difficulty in eating. So as I've been telling you now, the lung is the most common damaged organ, and these are long-term sequelae of COVID. And you can see that this lung has become permanently damaged. I told you earlier, it's my impression that the third wave or the fourth wave of COVID are the post-COVID syndromes. People who had COVID got damaged, and now they're suffering from this effect. Some of this effect will be lifelong. It's never going to go away. Remember, you know what this is? This is a burn in the lung. Imagine if somebody's skin gets burned, they get all those marks, those fibrotic scars, कभी किसी को आग लग जाएगी, so it gets burned. That never, the skin color never changes, right? Or if after a surgery you get a scar, that never changes. This is a scar of a lung. This is never going to go away. This patient has lost lung function. I don't know how much. For this, you need to do a lung function test. But the damage is there, the damage is permanent. Now, I do not subscribe to doing many CT scans, but you definitely need to do 1 or 2 CT scans and then do 3 monthly or 6 monthly lung function testing to know how much of the lung is damaged. This very interesting article that came from the UK, you see, this is the uptake on a PET scan by a normal lung. All the lung is working, all of the oxygen is going to the whole lung, upper, everywhere. This is after COVID. You can see that this lung is burnt. Ye khatam ho gayi hai lung. There is no oxygen going in this lung. It's only going here. Most of the lung is damaged. This is the permanent and unfortunate damage that is caused by COVID. Even those people who are not hospitalized, even those people who had mild COVID, most of them will have some of these small scars in the lung that will be permanent. And I'm afraid that this is something we need to look at very seriously in the future. There's somebody here whose CT scan this is. I will not take the name. I want to thank them for lending me the scan. This was the second scan 1 week after hospitalization. You can see these damaged fibrotic scars, and you can see with the medication that we gave him, the lungs are completely normal. This patient was on oxygen for about a couple of months. Now back to work, completely leading a very important position and able to do most or nearly all the work. So it's not that we cannot help these patients. You just need to be able to take the help very early. We have treatments that are available. Do not ignore them. And for this reason, we are proposing lung function testing at home. I'm very fortunate that Dr. Vikram has kindly agreed and will lead this initiative. Any of you who are listening to me or any of your friends, if you have any interest, symptoms, or any concerns, please talk to Dr. Vikram. Through the help of Sun Pharmaceutical and Akash and Mr. Vasan, we have proposed to do lung function testing in your building. We will come, we'll do the lung testing, and we'll give you the report. We are fortunate to have the first fully disposable lung function equipment. So you don't have to worry, the whole tube will be thrown. We are at the moment working on a very significant discount. Because of the nature of the thing, we can't do it totally free, but we're trying to work on a good discount. I think this is important for anybody who's had COVID to know how much was that effect on the lung, and especially those who have cough, breathlessness, smokers. And even if you didn't have COVID, remember you had a disease called Mumbaiitis, which means you are exposed to the pollution of Mumbai. So you may like to take advantage of this testing. What are the other symptoms that are there? Between different studies show between 50 to 90% of people will feel weak 2 months later. A large number of patients will have shortness of breath, which can go on for 2 months. Chest discomfort, I've been telling you. Cough, 2 months. No loss or taste or smell, 1 month. Other symptoms like joint pains, headache, dry eyes, loss of taste or altered taste, nasal congestion, loss of appetite, dizziness, body ache. Oh, loss of sleep is so common. Loss of hair is very common. And once in a while, about diarrhea. What about the neurological symptoms? About one-fourth of the patients in ICU, I told you, have post-traumatic stress syndrome. They feel very disturbed. They don't get comfortable sleep. They keep asking for sleeping tablets. droplets. Many people say, I have a foggy mind. Doctor, वो focus नहीं आता. I remember to do things, but I forget phone numbers and all. And all this is post-COVID. Poor concentration, anxiety, depression, as long as 2 months. 51% of patients in this felt their quality of life had been damaged after they were hospitalized. Means more severe the problems. Also, people had more comorbidities. Who should get follow-up? Everybody should be followed up. Do not ignore. If you had been hospitalized, after 1 week, you should be seen again after 3 weeks. If you were younger, at least once you should be seen by a doctor to check if there is any problem. I'm going to end on this very happy note. This is a today morning's graph, and I'm happy to show that across India, the total number of patients are only 42,000, which is nothing considering that we had 4 lakh patients. So there's a 90% improvement in the number of patients. It's less than what we had previously. And the Mumbai numbers today are 660, which and Dharvi is only 6. So I think we have overcome the big storm. We are yet the hotspot, but clearly our numbers are better. At Leelavati, we were fortunate. Out of 4 wards, we have shut down 2. Out of 2 ICUs, we have shut down 1 because we just don't have patients. So I think this is a very good sign of recovery. I'm going to end with this notice, I mean, this, shall I say, reminder: prevention, prevention, prevention. Oh, for God's sake, you must continue masking and social distancing. I don't know why people take that masks off. This is with us. It is here for us to wear the mask. I don't know how long, but that mask has to be on the nose and the mouth. I get these people who have a mask. I was joking with my friends in USA. Every Indian has a mask. Half the masks are at home, the other half are on the throat. नाक पे और मुंह पे तो है ही नहीं. And that is why we got the second wave. If we do not take precautions, we'll get a third wave. But in third wave, hoega hi hoega. Question, of course, is whether it will be a big wave, small wave. When it will happen, nobody knows. Everybody is talking without any scientific basis. But there will be a small wave at some point in time, which is going to happen. So, vaccine. Anybody asks me which is the best vaccine, and I tell them the best vaccine is the one which is in your arm. Take it. Just take the vaccine. Go by the duration of the government of India. People who have had COVID, in my opinion, are really protected. But after 3 months, they can take the vaccine. I was honored by the governor at Raj Bhavan, who presented me this certificate. I don't think that is important. What is important is the love and affection of our patients who got well. These are 2 of my images. This was our first PPE suit. This is the one we are using now. Actually, we have a new one which we use for our patients. And we do our best to help you. Please help yourself. Wear a mask. I want to thank you very much for your kind attention. I hope I've not gone over time, but I hope I've been able to help with some of your thoughts. So, if there are any questions or any, uh, yeah, Mr. Vasan, thank you very much. You are always the kindest person I know. So, it's great to have my dear friends here. If there are any questions, any thoughts,
Wonderful, sir.
anything I can do, I'm happy to. It's a pleasure.
You have, sir, covered most of the questions that most people would have. There are still a few questions which are cropping up. One is, I would like to ask on behalf of some people, what is the average cost of a pulmonary function test?
So the average
Multiple
cost,
questions
very,
towards it.
yeah, sure. So the average cost is used to be 1,500. We now have 2 stages of disposable, shall I say, mouthpieces. One is a mouthpiece with a filter, and that if we use extra, then it costs 1,700. If we use a fully disposable PFT machine, then it is 1900. That's it. And now we are trying to come to a very good price for you, because really we have to bring the machines and all. But yeah, I wish we could do free. Thank you.
Okay. Now, I would like to bring this out in front of everybody who's attending the webinar, that the entire purpose of holding this webinar was, since the past year and a half, what is being promoted was a blood test called CRP and CBC, which I'm sure most of the people here have been hearing. I think now we've reached a stage where most of us know that, and now we need to see what we should do so that we prevent further complications. And in case complications have occurred, how do we counter that? For that, the only uh, tool we have, weapon we have in our armamentarium is the PFT. CTs only give us a very rough guide, but please, everybody present here, if you had a family member who suffered from COVID, please, you can contact me. We will try to bring down the price further, or else you can contact anybody under whose treatment you have been previously. But please do a PFT to ascertain the lung damage that you or your dear ones have already suffered, so that further prevention or further damage can then be prevented. Sir, I have a question saying that I got COVID positive in last week of October. I was symptomatic and home quarantine and cured after 10 days. Before COVID, my weight was 72 and now my weight is 63. So how can I regain my weight?
Okay, so good question. Now I want to tell you this, that most people will put on weight again. The weight will be more than before. So please, those who have lost weight and want to lose weight, do not try to regain it. It will all come back. It will come back with the bang. As far as getting your normal weight back, if that is a weight you're happy with, then don't worry. Just let the inflammation go down. Now, there are two reasons for the weight loss. The initial weight loss is because of the disease. The latter weight loss is because of a persistent inflammation. If your CRP is normal, you're likely to be, your weight will come back on its own. If there is a high CRP, or if there is a high D dimer showing, or ferritin showing that you are in a persistent inflammatory phase, then maybe you should take some drugs like colchicine so that the inflammation comes down. Okay, so I hope that answers the question. Don't try
So
to
if
put
I
on
may
weight.
add to this, if I may add to this, because of the inflammation and the other conditions, protein loss in this gentleman may have occurred, and maybe a good protein supplement could also help him to, regain his weight.
Oh, definitely. I mean, obviously, the best food you can have. There are many food supplements. You can take any one you like. Proteins are
Yeah.
always good.
So
Sure.
another question is, before third wave, children should take flu vaccine as a precaution. This I'm sure would be a question with several people, because in the media we've been hearing that children are most likely to be affected severely in this present condition. So your view, sir.
So I'm smiling because I don't have a good answer to this. And the reason is this. Dekho, in my opinion, I don't think the flu vaccine does anything good at all. If you understand which country had the maximum deaths from COVID as a percentage, USA, which was the country that have had maximum deaths from COVID in the number of people who got it. So the deaths per population is Europe. And which are the countries which had the maximum flu vaccine? These are the countries. Who are the people who have taken the maximum flu vaccines? All the elderly. Who have died more? The elderly. So I don't think that the flu vaccine is doing anything at all to prevent COVID. So therefore, in my opinion, should you take the flu vaccine? If you believe in it, go ahead and take it. And if it is recommended by your doctor, but based on my reading of science, I don't see the flu vaccine helping anybody against COVID. The only thing that helps against COVID is a COVID vaccine, which is one of these five. And none of them are approved for children at this time, though logically they should work. And also logically they will ultimate, because studies have started. But don't rush into them because we don't know the effect, we don't know the side effect. Let the research be done, then we'll get into it. The best thing for children is that they're already protected. I was talking to my pediatrician colleague today, and she said, Sanjeev, we have tons and tons and tons and tons of children. In fact, when somebody very close to me had COVID, I asked the pediatrician because that person had two children who were 1 year and 3 years old. And he said, Sanjeev, the moment mother gets COVID, we are assuming that the child is COVID, which means that most of the children in India have been exposed to COVID. Fortunately, none of them have had any symptoms, just ikka dukka patient. So my thing is, I think God is taking care of the children. Okay, for those who are atheists, children are protected anyway on their own. Uh, I don't think the vaccine does anything great. The flu vaccine, but if you're requiring to take it, go ahead. I mean, I'm not against it. I just don't think it works. On that, I have another question. Are allergic patients more prone to COVID? And my answer to that is no, not really. Not, I think allergic patients have nothing to worry. In fact, at one point in time, there was a lot of data which said that patients who are asthmatic and have taken the inhaler are actually protected against COVID. So the nasal spray, the inhaler are actually protecting you against COVID. There's some science to that, that is down regulation of the ACE receptors. But first thing is you have nothing to worry about COVID. Second, all this question, and that's the next question. I'm surprised you've not yet asked me. Yes, I remember this patient. I've got that message here. Yes, I do. Okay. So the other question that's asked to me is, मेरे को ना बचपन में नींबू से एलर्जी थी. Can I take the vaccine? Yes, you can take the vaccine if you have any allergy to anything, whether it is anything. Allergy is not a contraindication to the vaccine. Please go ahead and take it. The only people who cannot take the vaccine, which is the RNA vaccine, are those who are allergic to polyethyl glycol. And who's allergic to polyethyl glycol? I don't know, because I don't even know where it exists, except that it exists in other vaccines. So if you had an allergic reaction to a vaccine, you may not take it, but that also only to the polyethyl glycol vaccine. So if you have had allergic reactions to other vaccines, you can yet take it. So essentially, at the moment, the scientific information is everybody can take the vaccine. Okay. So मेरे को aspirin allergy है, मेरे को भुर्जी allergy है, अंडा, you can all take it. Don't worry about it. Okay. So just relax, put your mind at ease. If there's any problem, call me. I've had actually patients calling me as they're entering the vaccination center. Doctor, I'm in the vaccination center. I'm taking the vaccine, injection. They give me a running commentary, and I'm there with you. So don't worry, nothing is going to happen. Everybody's going to be fine. So that's the allergy. Okay. Now
Sir,
I have another.
I have a question coming in. My mom is scheduled for her second vaccine, but during her first dose, she had a face reaction and had to take Allegra 180 mg to bring down the reaction. He is scared. Should he go ahead with the second dose?
Okay. So that's a good question. What I would do for this individual is take the Allegra before you take the vaccine. So this is not a life-threatening reaction. First of all, we don't know if it is because of the vaccine. Secondly, it's not a life-threatening reaction. You be in touch with your doctor or me. I would give this patient Allegra before going for the vaccine, and maybe even a small dose steroid, and then take the vaccine on that day. And hopefully, you'll not have a reaction. So I
Before
because the whole thing is this, that remember that you ultimately need the vaccine second dose. I don't think it will be very worrying. So one of my patients, what I did was we brought them to Arogya Nidhi, and the person who gave the vaccine was our anesthetist. So if there was going to be a reaction, we had an entire team. So for anybody who has an allergic reaction, I would suggest you take it in a good hospital with full medical support systems like Leelavati or Arogya Nidhi, where the entire system is available. Do not take it in one of those, like somebody is taking it at Lion Center or Rotary Center. If you have a reaction, do not take it there. Take it only in a hospital with full backup, with your doctor available, and keep the doctor in the picture.
That is, I would say, a very, very valid point. There are several people who are very apprehensive about these things. So what sir has just mentioned is, for the second dose, in case there has been a reaction at first dose, please be careful where you take the second dose. And there are always ways around it that you can ensure that nothing untoward happens.
Sure.
Sir, I have a question. When will
Before
the
you go,
beta version
somebody's
of
somebody's asked me a question. Can I do internship? You're welcome to talk to me. I don't have an internship program under me, but you're most welcome. I'll guide you into where they can do that for B Farm. But yeah, you're most welcome to contact me. And if you need my
yeah.
phone number, Dr. Vikram Pal has my phone number, and I don't have
So
WhatsApp.
so there's a question: when will the beta version of COVID hit India, and what precautions should we take to prevent? The beta version, I presume, is the Delta Plus version, what is being circulated in the media.
Okay, so I'm going to answer this question in detail for everybody's benefit about not only the Delta version, but other things. So one of the things is just my reading of the literature and the science that we have. One of the things that I feel is that all the vaccines are 100% protective against death. Most of the vaccines are 80% protective against severe infection. Natural infection is probably 99% protective. What I'm trying to explain to all of you is, do not be so scared. Do the precautions. People who've been vaccinated, even if they get a breakthrough infection, you understand the breakthrough infection means even after vaccine, if you get an infection, it's going to be mild. It's not going to be severe. I've had many patients of breakthrough infection. Most of the time, it's a little fever, it's a little bit here and there. They don't have anything serious. They don't get into hospital. Even if that 1% gets to hospital, then none of them have got into ICU. Which makes me come back to the original question, when will the beta or the Delta version hit us? We already have the Delta version. And there will be other further versions and mutations. But overall, it has been seen, if you've been very well vaccinated, the chances are that that virus will not do you any harm. Remember, the virus has mutation in only 3 points. You have antibodies against a much larger version. In fact, my whole impression is that these Indian vaccines are better than the US vaccines because they were only against a part of the spike protein. Our vaccine is on the whole surface. So therefore, I feel that there will not be a very big wave. If it happens, like I don't think there are reinfections. So I think if everybody is vaccinated, everybody wears a mask, we don't have to worry too much about the next. But this virus has proven me wrong every time. So I really hope I'm not proven wrong this time. But so far, if you look, Italy has not had a second wave. Italy was the first country to be hit. When was it hit? It was hit in January 2020. There's no second wave. New York, no second wave. Dharavi, no second wave. Um, no second wave. Our slums of India, no second wave. So really, areas that had a really severe infection first time did not really have a second wave. That is the data that I'm looking at, and I think we'll be okay.
Fine. Sir, I have another question. Role of zinc, vitamin C, and other nutraceuticals.
Great time pass.
Okay. So
Okay,
I
I have
think
a question. Why people are more prone to falling sick, as in they had stroke with COVID after immediate vaccine? That's again a good question. Many people are falling sick after the vaccine, and we don't know why. We have really no idea why. Sorry, 1 second. From hospital. Hello, मेरे को थोड़ी देर में phone करना. I'll call you back. Huh? Or call me after half. Okay, so yeah, so we don't know why people are falling ill after the vaccine. Is it an allergic reaction? Something, and this is only for Dr. Vikram, not for all of the lay people. But one of the things they feel is that there is going to be some immune interaction, probably working at the T cell level, that causes a partial attenuation of the immune response temporarily. And that may be the reason why immediately post vaccine, people are getting a little more infection. We really don't know. By and large, it is very minimal. We have seen a few cases. I don't have a good answer. It's a good question. We don't have a good answer. How should school take precautions after school starts? I don't know. I don't know how should schools take precaution. By and large, kids are okay. You imagine if you're a teacher going to school with kids without mask. I'd be very scared if I was a teacher going to school without masks. But I think you should wear an N95. I make a strong pitch to everybody. Please wear an N95. Somebody says that you're not getting a slot in Arogyanithi. Yeah, I will try our best to help you. Your doctor is out of town. You have high BP, no problems. That can be taken care of. I hope I've answered most of the questions. But back
Sir,
to Dr. Vikram.
I would like to interject here. You said Indian vaccines are good. People should take it because I have a lot of people who say Indian vaccines are not good. People should take the foreign vaccines. And here you said it on record that Indian vaccines are good because they have the entire virus particle incorporated in the vaccine, which would definitely help most people.
I think so. The antibody response, in my opinion, by the whole virus particle is better. But remember, most of the data comes, which is funded by pharmaceutical companies.
True.
So, they will like to say that the mRNA vaccine, because they have to justify the cost, na?
Cost, yeah, true.
एक 300 रुपए की, एक 3000 रुपए की है. So they have to try to justify it. And somebody's asked, is there a doctor specialist in allergy? Vikram,
You have it in front of you.
I'm an asthma allergy specialist. If anybody needs,
The person who asked the question can contact me. I think, sir, we've answered most of it, and I think most people would have answers to most questions that they have. Uh, Thank you so much for holding this webinar. And I would like to go on record by saying I do not have any financial gains or any financial motives in moderating this talk with sir. It's just that I really want to bring it out to people that please go in for tests post-COVID so that you can prevent further complications that you or your family may be facing and they're not known to you. Things can get really bad in the long run, sir. In fact, I have two patients in Delhi. One of them is a pilot. He had a bad episode of COVID in April. He didn't do anything for 2 months. Now in the month of May, when he went for his follow-up before he could start flying, they found his lung function test had gone down. Now it's been 2 months. He's not taken medications today. He doesn't know, and his career is at stake. So that was the thought that was playing in my mind. That's why I wanted to speak to you about this, so that people know about this test, which is available, and let people use it. With this, I would like to end. Thank you so much, sir, for spending your time. And thank you everyone to attend this webinar. Thank you.
thank
Good
you.
night.
Bye. Have a good night, everybody. Thank you.
Doctors.
Bye.